We are back. Journey to 600. Today we're going to be talking about acidosis versus alkalosis. So first I'll just talk about the lab values of pH, CO2, and bicarbonate, and then we'll break it down by respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Then we'll give a summary, go through some practice activities, and then lastly, we'll have 3 practice questions for this topic. So for lab values, you're going to be looking at 3 different values. So you're going to look at pH, you're going to be looking at the CO2, and then bicarbonate. So I think it's easiest just to remember those normal values. You'll be able to know what's outside the range if you just know those normal values. So normal values for pH is 7.35 to 7.45, CO2 35 to 45, bicarbonate 22 to 26. So anything outside those values are as follows. So respiratory acidosis. So respiratory acidosis, the pH is low. The CO2 is high, but the bicarbonate is normal. The presentation is lethargy, confusion, altered mental status, and cyanosis. It is caused by hypoventilation due to either pulmonary disease or medications that suppress breathing, structural factors that limit effective lung expansion, such as severe scoliosis, and conditions that cause respiratory muscle weakness, such as GBS or ALS. Hypoventilation prevents adequate removal of CO2, leading to hypercapnia. That's why you have that high CO2 and leading to that lower pH. So typically the resolutions, the kidneys decrease excretion of the bicarbonate, and that helps rebalance these values. Respiratory alkalosis, so this one is different because the pH is now high and the CO2 is low, but again the bicarbonate is still normal. It presents with tachypnea, tachycardia, and dizziness. It is caused by hyperventilation due to respiratory conditions such as pulmonary embolism and asthma, medications, and internal influences such as a CNS response to trauma, pain, anxiety, and fever. So that hyperventilation removes more CO2, leading to hypocapnia or low CO2, and then therefore leads to a higher pH. Its resolution is that the kidneys increase excretion of bicarbonate to help rebalance those lab values. Metabolic acidosis. This is a condition that occurs when there's an accumulation of acids due to acid gain or bicarbonate loss. As a result, the pH drops below 7.35, so you have a low pH and a high bicarbonate, but a normal CO2. It presents with a headache, weakness, malaise, and cardiac arrhythmia. It is caused by conditions such as renal failure, lactic acidosis, starvation, diabetic or alcoholic ketoacidosis, and severe diarrhea. The resolution or treatment for this is either you will see them hyperventilating or you will have to administer sodium bicarbonate to rebalance these lab values. Lastly, metabolic alkalosis is a condition that occurs when there's an increase in bicarbonate accumulation or an abnormal loss of acids. As a result, the pH rises above 7.45, so the pH is high, the bicarbonate is also high, and you have a normal CO2. It presents with confusion, muscle cramping, convulsions, and paresthesia. It is caused by continuous vomiting or ingestion of antacids. In the resolutions, either you will see this compensated hypoventilation or you will have to administer potassium chloride. So how do you remember all those lab values and determine what is the condition? So this is a flow chart that kind of helps guide those decisions. You will first assess the pH to determine if they are in acidosis or alkalosis. So if the pH is less than 7.35, they are in acidosis. If the pH is greater than 7.45, they are in alkalosis. Then you will assess the partial pressure of carbon dioxide, and if it is low, you have respiratory alkalosis, and if it is high, you have respiratory acidosis. If you're looking at the partial pressure of carbon dioxide and is normal, then you need to look at what the bicarbonate is. If the bicarbonate is low, you have metabolic acidosis. If it is high, you have metabolic alkalosis. So you just kind of look at one lab value at a time, determine if it's low or high or normal, and that will help you determine through this flow chart. All things that are respiratory in nature, so respiratory acidosis or respiratory alkalosis, so it's being caused by these breathing issues, hypo or hyperventilation, then it will have renal compensation because the respiratory system is ineffective right now. The renal system will either decrease or increase the bicarbonate excretion. If it is metabolic in nature, then the respiratory system will help fix it, or you might have to give some other ions or electrolytes. But if it is metabolic in nature, then it's going to be fixed by the respiratory system, so that'll be hypo or hyperventilation. Another way to remember this association of whether it's metabolic or respiratory is the acronym ROME, ROME. So respiratory in nature is going to be that the values are opposite. So you have to know that you're looking at pH and partial pressure of CO2 for respiratory, but those values are going to be opposite. So when the pH is low, the CO2 will be high. And then for metabolic, the values are equal, so ME. Metabolic equal, but you have to be looking at the pH and bicarbonate. So for metabolic, when the pH is low, the bicarbonate is low, or when the pH is high, the bicarbonate is high. So ROME, respiratory opposite, metabolic equal. But here are some practice questions, and we'll kind of go step by step. So determining the condition, the patient lab values are as follows. pH is 7.3. 7.3, that qualifies as acidosis. Now looking at CO2, that is 60, so that is high. And now we have two abnormal values. So we have a pH that is low and a CO2 that is high, so that is opposite. So you are looking at respiratory acidosis. And also looking at the bicarbonate, that is normal. Next one, the patient lab values, pH is 7.5, so pH is high. Carbon dioxide is 40, which is normal. And then bicarbonate is 28, and so that is high. So you have two abnormal values. They are both high. The pH is high and the bicarbonate is high, so therefore that is metabolic alkalosis. The metabolic comes from that the bicarbonate is high with the pH being high. The alkalosis comes from the pH being high. Okay, now to the actual practice questions. Which of the following arterial blood gas readings indicates alkalemia? A, 7.2, B, 7.3, C, 7.4, or D, 7.5. I'll give you a moment to answer. Please pause if you're not ready to review. So what is alkalemia? This is when the pH is elevated. So do you remember what the normal pH values are? So normal pH is 7.35 to 7.45. So D is the best answer, 7.5, as that is greater than 7.45. Next question, when chart reviewing your patient, the record indicates the patient has been diagnosed with chronic respiratory acidosis. Which of the following lab values would be in the patient's chart to indicate this condition? A, elevated arterial blood pH and elevated partial pressure of carbon dioxide. B, elevated arterial blood pH and a low partial pressure of carbon dioxide. C, low arterial blood pH and elevated partial pressure of carbon dioxide. D, low arterial blood pH and a low partial pressure of carbon dioxide. I'll give you a moment to answer. Please pause if you're not ready to review. So respiratory acidosis, Respiratory means you're looking at opposite lab values. And it's great for these answers because none of them are looking at bicarbonate. So I don't have to think, is it bicarbonate or is it partial pressure carbon dioxide? So you just need to know that it's opposite. But second piece, acidosis means low or high pH. So acidosis is when the pH is low. So mark out A and B. So I'm looking at C and D. And which one of the answers are opposite? So C, a low blood pH, and then an elevated partial pressure of carbon dioxide. So C is the best answer. Last practice question. A physical therapist is seeing a patient in the hospital for a PT evaluation. They have been hospitalized for 1 week with a past medical history of renal failure. They report a new onset of headache and malaise. Upon observation, you note increased rate of breathing. Their lab values are as follows. pH is 7.3, partial pressure of carbon dioxide is 38, and bicarbonate is 20. Which of the following is most likely their diagnosis? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. I'll give you a moment to answer. Please pause if you're not ready to review. Okay, so from this question, what are you seeing that we talked about today and what can we group together? So they have a past medical history of renal failure. We talked about that today, how that can lead to one of these issues. Their symptoms are headache and malaise and an increased rate of breathing. And even if those symptoms are not giving you a picture of who this patient is, we do have lab values that we can determine. So pH is 7.3. That means their pH is low, so they're in some kind of acidosis. So we can rule out A and C. Their partial pressure of carbon dioxide is normal, 38, because it's between 35 and 45. Their bicarbonate is 20, so that is actually low because the normal is 22 to 26. And if the pH is low and the bicarbonate is low, that means we have a metabolic issue going on, so metabolic acidosis. So D is the best answer, metabolic acidosis. Thank you so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.